Doctor, the next big question is, what about the money you're spending on ads? And when you say to yourself, what do you mean the money I'm spending on ads? Well, if you're spending any money on internet ads, whether they're Google ads or doing all kinds of sophisticated things, pay-per-click and all these other kinds of things that I barely understand myself, what I want to know as a small business owner, if I'm spending $1 on ads, how much business am I getting because of that ad spend? And that's called a return on ad spend, a ROAS score, R-O-A-S, ROAS score. And what you're looking for is an A, because let's face it, doctor, that's all you and I get are A's. So what does that really mean? It means that for every $1 that you spend on internet ads, you should expect $5 worth of new dental business to your practice. So how does it all start? Well, it starts with what we already talked about, which is the user experience. How do patients feel when they go to your website? Do they like what they're feeling, and are they willing to want to call your office or do a form fill? Starts there first. But more importantly, is the company that you're working with, are they being proactive on the internet to make sure that you rank in one of 3 places? Of course, the paid ad, and we've all done Google searches. The paid ad are the people at the top. The map pack, where you see different businesses and a map right next to them, is all based upon reviews. Do you have a robust and proactive review system within your office? And of course, at the bottom of the page is the organic search, the SEO stuff. And that becomes relevant when you add new content to your website. So what you need is you need your web company to do 3 things for you. We need them to manage the paid advertising based upon patient intent when they're searching for things like find a dentist near me or find an implant dentist near me. The second thing your company needs to help you with is the Google reviews. Do you have QR codes? Those little dotted things that we see when we go to restaurants? You have QR codes posted throughout your office to make sure that patients give you reviews. And of course, the third thing is your website company, are they producing and posting new content every single month where you're the author, you're the authority? Because Google's going to reward you if they feel that you're a good steward of your practice within the community to which you serve. So be smart with your website company right now. If they're not doing those things for you, they're not actually being moderate, up to date. And you're spending all of this money because remember, at the end of the day, your return on ad spend should be at least 5 to 1. So with all of that in mind, start to think about where you are and where you want to be. Because if you haven't changed any of this stuff, or the company that you're working with hasn't updated any of this stuff for you, you're being cheated, and that's just not fair.